Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with facial balancing and collagen stimulation as well. I had a lot of cool cases today, a lot of acne scars, a lot of facial balancing today actually, a lot of pigmentation as well. So it was a really, really cool day, and I'll walk you through just what I had to do to get amazing results for our patients and this particular case as well. This is a really, really wonderful patient who I've been working on for the last year and a half. And we're pretty close, actually, pretty close to what she was trying to shoot for, which is as smooth of skin as possible. Really difficult case because she has some hyperpigmentation. She had some, I should say, originally. And she also, really with her skin type, she really could get more pigmentation. So it took a lot to balance this, a lot to make sure that we could get this this kind of amazing result. And then when she came in this day in February, we ended up doing some more with TCA CROSS at that point, and then also a little bit of volume as well. And she'll continue to get better improvement. So at some point I'll see her again. I'll show you an updated photo for her. But it's awesome because this is a case that's pretty complex. Patient of Korean ethnicity with some hyperpigmentation originally, some acne scars. She has a mix of boxcar scars and rolling scars and ice pick scars. And we were able to get really, really a nice soft look over here. So you can see this, again, really complex case right here with a patient with mixed skin type because even though she looks like she may be relatively fair skin, that's why you don't go based on skin type, skin color, I should say. You go based on their propensity to actually get burned or tan when they go in the sun, and then also ethnicity matters a lot. And in this case, actually, this patient's ethnicity being Korean skin type, we are always concerned with hyperpigmentation. Also, raised scars like a keloid formation, really, you could get that relatively easily in their skin type. So you got to be very, very careful as we work on particular skin. Joe Goldberg is asking, is this subcision? We did do subcision for this patient originally. We did do that actually originally too. How many TCA CROSS sessions? We did 4 total for this patient, about 4 total. And the first step was really with a combination session. Then we did a few times with TCA CROSS as well as some Bellafill as well for this patient. So we still ended up doing again when she came in this day in February. We did a little bit more TCA CROSS, a little bit more Bellafill for her. The Latin Catolico is saying, does subcision cause skin sagging? That's a good question, Latin. I think that it's really worth paying attention to. First of all, when you have scars like this patient has and it's pulled down and stuck, that by itself could cause sagging, because what ends up happening is that there's some tension. There's basically these tethered bonds, and as you're smiling and you could stretch out the skin over time, over the next several years, that could cause the skin to get looser. So just acne scarring by itself could cause sagging. And then with us, in this particular area of the face, breaking up that scar tissue significantly allowed the patient to express herself and smile. She had a more full smile afterwards. But if you do certain tools in the lower part of the face, it is possible to cause sagging. And even in the mid-cheek area, if you go really close to the nasolabial fold or past the nasolabial fold with some blades, that's also it's also possible. And you may be displacing some fat pads or so. But it's also, the thing is that your natural skin, if you haven't seen it for a while, your scars have actually pulled down your skin for so long, you may not necessarily know how you normally should look with your scars lifted up. So it's tough to necessarily say sometimes with some patients how they would have aged if it wasn't for scarring. And we're allowing you to age the way you should age. In this patient, for example, she was finding that she was looking as if she was a little bit older. She felt that she was a little bit older because of her scars. And now it's like a way of anti-aging, de-aging her. So just from the scars. Hi, Mrs. Jones. Good seeing you on too. Thank you so much. Mrs. Jones is saying it's great improvement. I'm sure she is happy. She's very, very happy. Thank you so much. She is trying to get closer to like a fully polished off look, and we're getting close to that. So I'll see again if at some point when she comes in again how close we are to that. I actually had a patient that I worked on before. I showed her results before in the past, and she came in today at the end of the day. So at some point, I'll show her updates. She did 2 sessions now, and her skin's looking so smooth. She had very severe scars. So at some point, I'll try to show her result as well, which is an awesome result. Let's see here. Sam is saying, I have scars. Which treatment is good for you? Just let me know what kind of scars you have, and we could take a look and see. Particularly, if you're not sure what kind of scars, I could go through the types of scars. Like this patient, she has boxcar scars, she has ice pick scars, and when she smiled, she had a bit of rolling scars as well. Kofi, good seeing you on, Kofi. Kofi's asking about TCA CROSS. So sometimes it could take 4 to 6 sessions. It depends on your collagen response. It really does depend. The patient I was talking about today who had very severe deep scars, we've done about 4 sessions of TCA for her and 2 sessions of ablative CO2 laser. She's Fitzpatrick 4, and it's really smooth for her right now at this point. And she says that she takes collagen supplements, which I ended up working out for her some collagen powder. But she's, everybody's collagen response is different. So it could be 4 to 6 for some people for TCA CROSS sessions, maybe, some more, maybe some less. It just depends on how fast your collagen response is, which is why I never do that as like a package or anything like that, because I just don't necessarily know how many you may need. Let's see here. Do you do SPO2 laser? I have boxcar, ice pick, and ice pick scars. Are you saying CO2 laser? Is that what you're trying to ask for? Let's see here. Can you help me with my HS scars in the chest and groin? Those actually respond pretty well with something like Bellafill. Could work very, very well for those. Lasers can help, of course, as well, but Bellafill could work really well. I usually don't do lasers in the groin area. It's not the best spot for lasers. It's really irritating. Risk of infection is high, so I don't usually typically do it there. But other areas for sure we could do lasers and like on the body, but maybe it just needs more like volume replacement. That may be what you end up needing. Skilroy is saying for mild acne scars and large pores and Asian Fitzpatrick 4, would you do both Halo and Profractional on the whole face in one session? Would you use Profractional on the chin and forehead? I don't love Halo in Asian skin types. I think there's way too much heat, too much energy. I don't love it, so I think Profractional is excellent. I think doing something like this where we do TCA CROSS, that's excellent. But Halo, you could run into more problems with the hyperpigmentation. If you're doing things that you have a lot of heat, high energy, you could do it what I did for this patient, which I did do ablative CO2, but I did it just at the edges of the scar, just focal point in some spots. I didn't do it for the full face. So it was very, very different than what people do. And Halo, actually, one of my patients today, she's somebody who she said that she had gotten Halo done and she never had scars. She was doing it for anti-aging purposes, but the way that they were doing it was so aggressive that it caused scars. And actually, it looks like she had acne scars, the amount of scarring she has on her face, because it's rolling and there's too much friction sometimes, too much heat. And she's actually Fitzpatrick 2, but it still ended up causing some scarring. And I've been working on her. It's really soft and much better now, but it's unfortunate that she had to go through all that process. Really unfortunate, because she did a device that maybe it wasn't the best for her skin, or the practitioner wasn't doing the best job for her. Jay is asking, what treatment would you do for my PIE face, post-inflammatory erythema? Well, that's a lot of times first topical creams, like you could try azelaic acid, control oil production as well. But one of the best things I found is XLV works very, very well. V-beam is another option. I personally carry XLV, and then there's another laser called Derma V, which is also supposed to be pretty good. I haven't played around with Derma V myself, but I think for darker skin types especially, XLV works really well because it's got a nice contact cooling, really nice, so it doesn't overheat the skin there. Let's see here. Where was I at? Does Tretinoin help with these kind of scars? So this patient was on Tretinoin. It helps a little bit with it, but it doesn't help enough. So I wouldn't really recommend it for most patients for these kind of scars. How much for ice pick and boxcar scars? So most patients spend about $5,000 to $7,000 on their scars, but it depends though. I'm not sure how much volume loss you have, how deep the scars are. It could take more work, more volume replacement. Then it could cost a little bit more, but most patients $5,000 to $7,000. Let's see here. Alan Hernandez is saying, I've got bumps around the back outside of my nostrils. How can I get rid of them? So what it sounds like you're talking about, you have these papular scars, these raised scars, and we may want to use either a steroid injection for that, or we could use a laser to smooth it down. And then what we do is actually through the laser tunnel holes, we put a little steroid, and then we can use silicone tape there to help keep it flat. So there's a few options that we could do, a few things that we could do for that. Let's see here. CT saying, sorry, I'm new here. What if my skin looks like the right side? Can it be improved further? First of all, a lot of people are new. Don't worry about being new. I like actually everybody just coming on, and don't worry. Like I like actually just having like a community where we just answer questions. And you'll see that a lot of people are very, very supportive and very happy to answer questions on here too. You can continue to improve your skin at that. Please stop moving away from the mic. Okay, so I'll try my best. But you can continue to improve it. This February date, it's going to continue to get better. It'll continue to get better at this point. So we worked a little bit more with TCA CROSS and then also with Bellafill. So it's going to continue to get better there. Let's see here. G is saying, I have ice pick, super red scarring, and hyperpigmentation. What can be used to treat all three? The thing is that you probably have to wait before you treat the pigmentation, both the red scars as well as the dark pigmentation. You typically actually want to start the scar portion first because it may end up needing to have something else for the red spots or the hyperpigmentation. And you just have to basically be patient with it. First, do the ice pick scars, do something with like energy device if you need to, with potentially like an erbium laser combined with TCA CROSS or a CO2 laser combined with TCA CROSS. And sometimes you actually have to do subcision where we go underneath the scar tissue, break it up like we did for this patient. Went underneath there, broke up that scar tissue. Those are all potential options. It's tough to say. And then with the red scarring, some of it does get improved because sometimes it's superficial. We pick up some of that red scarring, but sometimes you may need other treatments like XLV, which I was talking about earlier, which is basically going to target the redness over there. So that's one potential option. The other thing that may be for hyperpigmentation, you just need creams. But if it's really like just persistent, it's still stubborn, yes, of course, we could end up doing something like we use a laser of like, I use the Pico laser, works very, very well for that. Pico laser works very, very well for hyperpigmentation, post-inflammatory hyperpigmentation. I'm going to show you this. This is actually a nice little diagram here showcasing how we do subcision. Let's see if I could make this a little bigger for you guys. Let's see. Hopefully you guys can see it. Maybe it's too distracting on the back. Let's see. I'll try to see if I could fix this here. Oh, there we go. Okay, cool. Hopefully you guys can see that a little bit better. So take a look at this. This is how subcision works. This is actually a really cool diagram. I like this diagram a lot. Let me know if you guys can see it on your screen. It looks like it's okay on mine, but let me know if you guys can see this diagram here. This is cool because this is showing the fibrous bands. And in this case, I like it because it's a blunt cannula, which is what I usually use, blunt cannula. I'm going in there, breaking up the bonds that are pulling down the scars. And the truth is that almost all scars have some sort of tethered bonds like this. And it's like variable whether or not we necessarily have to treat them all the time. But in some cases, yes, we do want to go in there and actually manually remove that scar tissue. Go inside there and actually break up that scar tissue. And that's what we can see over here. So this is really what I do multiple times a day. This is with subcision. And again, in this case, blunt cannula subcision, which is the vast majority of the kind of subcision I do. Blunt cannula subcision. So that's what I end up doing right there. And it's pretty cool. You can see this whole process here where you could break it up. And then, they're showing it as if like it just rises and pops up like that. It doesn't quite rise up that much. Although I got shocked actually. Today I followed up with a couple patients. It was like pretty smooth, just like that. Actually, I did a phenol peel this morning on a patient. I did subcision on him last month. It self-lifted up. I didn't even do any volume. And that's pretty cool because it was like, the whole process, I broke it up, lifted it up there without any volume. And so, yeah, sometimes it pops up pretty well, but you still typically have to do something for volume, whether that's fat transfer or Bellafill, Sculptra, or hyaluronic acid filler, whatever you have to do, you got to do something for volume there. Maha is saying, Dr. Qazi, the laser edges are still visible after full ablative erbium. It's possible that you have to do it again. It's, sometimes depending on the skin type, someone may not be able to go deep enough or strong enough. And they're worried about losing pigmentation or triggering hyperpigmentation. So they may not go as deep or as strong as you may want them to. and it takes a couple rounds. It takes, the patient I saw today, I did a little bit of Bellafill on her today, but she's a month and a half out after her treatment. Her second step, it's so smooth now. Her first step was so good. Now, the second step is so much better, actually. And it's going to get better and better, actually, for her. And it's pretty cool. It's a pretty cool process because with these things, like really, we get one layer, we smooth it down, lift it up a bit with either Bellafill, or like if we just want to just keep on doing TCA CROSS, if there's not much volume loss, just keep on getting softer, and then cut it back down again a bit there. So, I mean, nothing really beats that, honestly. Nothing really gets like the same kind of result, especially just under 2 sessions like that. It works really well. And it's like, it's some people, if they could tolerate the laser, they did really well with sun exposure. They are people we could trust. They didn't suddenly pick up like a smoking habit, something like that, unusual, but let's just say they did. Then yeah, we could get really soft. You think Derma Stamp and Retinol works well for old scars? I would say it's pretty okay for it, but not really great. It's okay. Retinol is going to help with the oil production. The Derma Stamp will stimulate a bit more collagen, so it may help a bit, but it's not going to help much for these kind of scars, though. That's the thing. Patty's asking, do you sell skincare in your office? Just a few things that I need for recovery purposes, just like for pigmentation part, and then also just some sunblock. But it's definitely not like a big thing for us at all. We just give people Vanity cream. We give people Cetaphil, CeraVe, things like that. That's pretty much all we like to use for the vast majority of patients for the recovery process. You usually don't have to do too much more than that. So I'm not like a huge skincare person. I've been doing beef tallow right now though, and I'm working on that. I'm trying to just get it just to see what's going to happen with acne prone skin too. I've been liking it a lot. I've been playing around with it a bit too. So I think it's maybe something that I may incorporate also in the recovery process. I was like actually somebody that was like constantly like skeptical of it because of how much it was pushed by like these Amazon people. And now it's like, when you look at it, it's been working pretty well for my skin. Dr. Bimzel is asking, why don't you use needle for subcision? Well, I do use it. Like in this case too, I double check my notes, but I probably use Noker needles too for some of it. But like it's for certain select spots if I need to do it for some areas. But mostly it's like if I have to really do it, then I'll do it. But like a needle, it's usually most of it is just blunt. I mean, I could break up almost all of this with a blunt cannula. It's just that I got to sometimes be double check and triple check and then sometimes still feeling like there's still some resistance. I'm not loving the fact that there's still some resistance there. And I'll use a needle there at that spot. Or, if it's depending on the depth of the scar, maybe I'll do the tailor liberator, potentially. So it's variable, but vast majority of the time, I'm just mostly just using blunt cannula. PK Farnsworth, good seeing you today. Good seeing you, PK. Good seeing you. He's saying PK saying results are great here. PIH vastly improved too. Congratulations to you and your patient. Regarding Bellafill, how many vials are typically used in each session and how often can placement occur? Thank you. PK, for you, I would probably wait about 3 months or so. Just want to make sure that everything goes down with a cow collagen before putting a little bit more. And, we want to make sure, keep your particular anatomy. Don't want to make it overdone at all or anything like that. It's just going to go very, very slow. And it's looking awesome. So I'm going to go very, very slow there. But typically 1 to 2 vials per cheek. 1 to 2 vials. And I usually do it so it's 1 on each side. But sometimes I just do half and half. Or sometimes just a little bit, like a little bits in some spots there. It all depends on how much scar tissue there is and how much volume loss there is. But I typically don't do more than 1 in like an area. Let's say like the cheeks. I know that it needs a lot more, but like that first session, I just don't do that much and just let it relax and let your own body produce enough collagen around it. Karine is asking, when I pull my skin back, my acne scars look better, almost flatter and visible. What does this mean, and is a facelift better for me? It likely means that you still, first of all, it likely means that you don't have too much volume loss, which is good, and that's a good sign. But there was probably some area that's a little bit tethered there and still a little bit stuck, so we may want to actually break up some of that scar tissue. But there is some pocket of fat. What you're doing when you're pulling your fat, or you're pulling your skin, you are shifting some of your fat. So there's maybe not so much volume loss, but because you're not seeing just like a huge indentation still, but you're shifting some some fat backwards, and that fat is pulling back, and you're liking that volume replacement. So you'll need a little bit of volume. Chances are some subcision as well, but it sounds like it's not so complex that like you need to do like more surgical type of things like facelifts or anything like that. And one way to test if you are somebody that is appropriate for a facelift, for especially if we're talking about more for scars, just pull on your skin here. See how long it takes to snap back. Just see, like pull it and see, like, does it take a long time for it to retract back? I have patients that I recommend doing facelift, and they're, maybe in their young 40s or so. And it's like, they're surprised. They're saying, oh, isn't this something you're supposed to do in your 60s or anything like that? First of all, if you have the sagging or if you have that laxity, it's better to manage that earlier rather than later when there's a lot more damage. Second is that some people just have weight fluctuations. Some people are on Ozempic or other of these, any GLP-1 inhibitor or agonist, and they potentially lost some more weight, lost it rapidly, went on a diet where they lost some weight, and now you could have some loose skin, and then with that loose skin, your muscle and your fat could get displaced. So you probably, or you could be somebody who is a candidate for a facelift. Now, like what kind of facelift and what that entails, I'm not sure until we could see, I could see you, my partner could see you, and we could double check to see what's really needed. But I doubt it based on what you're describing, the fact that you're saying that you just pull it back and you're noticing that your scars disappear. That's actually the fat that's pushing into the scar area or pull up a bit there a lot of times. And you just need a little bit of volume in that spot and maybe some subcision. So that's probably where I would end up starting for someone like yourself. What are these pictures? These are acne scars. So these are boxcar scars and ice pick scars that you can see over here. We did a few different steps for this patient. We did TCA CROSS a few times. We did subcision. We did CO2 laser resurfacing. And we did some more Bellafill and more TCA CROSS for this patient. So it worked out really well. Hi, Sailor Moon. Good seeing you on too. Let's see here. First scar, is it good for collagen stimulator? I guess I missed the question, Paji. Doctor, do you recommend at-home derma stamping for superficial acne scars? Stamping is better than rolling, but I still don't think that it's going to be enough for these kind of scars. It's not like it's like going to hurt you if it's stamping, but it's probably not going to move the needle much in this case. Maybe afterwards, maybe after these treatments, something to continue going and improving the results. It's possible, but I'm not sure if there's going to be enough of an improvement for these kind of scars. These are very thick, deep scars, but I do prefer stamping more than rolling, though. I would not recommend rolling for patients. Tyler saying, wow, it's a great job. I don't live in the U.S. I live in Australia. Thank you so much, Tyler. I appreciate you. There's, there are people that focus a lot on this in the world, and hopefully you can find someone that's close to you that does focus on this and that can continue doing it at a high level. If not, I had a patient that I see regularly from Australia, a really, really nice gentleman. And he's done a lot of different treatments elsewhere, and he's a very, very good person, and his results are killer right now. I think at some point he's going to let us share his results. He said, and maybe after this session, like the next session, I'll show you that he's from Australia. I've had patients from New Zealand as well, so I understand it comes from you guys come from a very, very far away, 19-hour flight, 18-hour flight, but I'll take care of you. I'll make sure that we could do this really, really well for you. What would you do for a 15-year-old's acne scars? Likely controlling acne, oil control, as well as if you have little breakouts here and there, use hydrocolloid patches. You could use silicone tape, things of that nature to really prevent it from getting worse. Starting more topical creams. And I usually don't go and do any. I don't do any kind of procedures, active procedures for this. I don't use any active procedures for patients who are minors, though. And even honestly, sometimes even 18-year-olds, I was talking about the other day, that I don't really believe that everybody is like suddenly mature at 18. I expect people to have a certain understanding of this and really understand what's involved and really trust that they're going to do everything that we say to do here. Thoughts on scientific literature on the skin-gut link and anecdotal stories on diet's impact? That's a really great question. I am working on this. There's a lot that's involved with that, a lot with diet. I think there's absolutely
a lot of anecdotal evidence, and now there is some science now that's backing up the fact that diet does play a role. When I was younger, everybody kept on saying diet has no role with it. They literally just say there's no role with diet and your skin. It's just genetic. It's just this. But there's a lot of evidence now. I am working on a big project. It's actually we've been working on it for a long time. Just to give you guys a heads up, it's been really cool. We're working on sort of like an open, like it's going to be like a Wikipedia style type of thing where we're going to have it on our page. It's just going to be like just like all these kind of things that are just like, you know how everybody has like these ebook type of stuff. I'm just going to have it so it's just going to be like on our site, and it's just going to be like you could search and you could see all the things, and it's objective. You're going to see all the data, all the references. We've been working on it a long time. I was actually talking about it for months and months. We've been working on this, and it's going to be an awesome project. Actually, you'll see this whole thing. We're going to have it like step by step for diet purposes. What's the best things to do for acne? For like a lot of the common questions I've been getting on here, I'm building this into something where we are all, everybody on my team is listening to this, also watching this. They've been looking at this and seeing all these questions, and they're saying, okay, well, we could put this all together into something that's going to be really helpful for like ever. It's just, I want this so it's really clear for people that here's the things that like we see, the things that we know that are evidence-based, and then things that I see too. Like I'll insert here's the stuff that I see in my practice that, potentially the data isn't there yet, because it's just like I haven't been like publishing this stuff because it's just been like very busy, and it's just really difficult to publish stuff like that. And instead we're gonna just like kind of go through and just maybe it's just better anyway. You know how much it costs just like sometimes you go on these like articles, and in order to get the access to these articles, it's like $150 or so just to get access to the article. It's crazy. It's like you can't even get access to it. So I want this stuff like more open and available for people. I want it so that people could see that like exactly like if you have acne, what is the algorithm for somebody that we know that like you guys should know. It's like everyone says, well, people won't be able to understand it. They're going to ask too many questions and blah, blah, blah. It's like, this is just like, they actually used to say that when I was a med student. They used to say that like this stuff, like it'll stress people out, it'll make them nervous. But actually the scar community, the acne community is very, like people understand this stuff very well. They look at this, they do a lot of research with it, and people want to research this. They want to look into this more because they know that they suffered a lot. One of my patients, he came all the way from Kansas the other day. He's of African skin tone. And he said that he like just had no idea. Nobody ever told him what to do for his skin and for his acne. And he like discovered like a forum on Reddit one day, and it saw that like this is how you should do, like there's like a regimen that he discovered that ended up working really well to control his acne, help with his pigmentation. And it wasn't until that moment that he ended up getting some clearer skin. So like I appreciate the fact that he like did that and found all that, but like it'd be nice if there was like actually like proper data for somebody, and you could see exactly the best algorithm to follow to use. Especially, he said he couldn't get access to a dermatologist, couldn't see anybody else. My patients who say that their insurance didn't cover a dermatologist, so like we'll have it all there and available for people. So I think it's gonna be really cool there. Can you get treatments while pregnant? Really very limited, other than like azelaic acid typically. Not much you could do otherwise though. How to cure 1-month-old atrophic scars using retinoids. I mean, just try to see someone like myself initially, because we get help with that early on, especially early on, 1 month out. That's really fun to do because you get a really cool response actually. So try to see me. I know you're saying do it with retinoids, but just try your best to get something, to get a proper evaluation, because it's possible we could get this healed really fast actually for you. Have very deep pits, had CO2. How long will it take to see results? So, I mean, there's collagen stimulation with CO2. That could take almost a year. That could take almost a year for that collagen stimulation. So that's a slow process, and it gets a little bit lifted up, a little bit softer. The way I do CO2 laser is at the edges of the scar, and then I use another blend of laser really to help a bit more with softening it up. I do TCA CROSS to stimulate collagen directly at the scar, at the depth of the scar. I broke up the scar tissue, did some volume here, so it was a few steps, not just laser here. So, I'm not sure if the laser by itself would help for you. T's asking that I didn't see the message. Does Tretinoin cream 0.5% help to fade hyperpigmentation? It's pretty weak for hyperpigmentation. Helps a little bit for it, but it's pretty weak. If you're talking about like just like brown discoloration, I'm assuming you're talking about that. You could try Eucerin's pigmentation cream. You can combine that with a retinoid. That could help out really well. Hola Liz. Liz is saying yo quiero. Look forward to helping you, Liz. Let's see. Can you talk about stretch marks? Could Verporphin help? Well, Verporphin really involves excising. So if you're talking about stretch marks and you do something like a tummy tuck and then you look for the tummy tuck scar, then potentially that could help. But otherwise, not going to help too much with stretch marks. And it's very, very expensive for that. So instead, maybe consider doing just like an erbium laser. And what I did for a patient last week was I just did a dilute form of Radiesse for that. And it works out really, really well. I do that so often, actually. It works very, very well. Why are some scars bigger than others? It could be that there's a cluster. It could be that there was like a couple acne lesions together really close to each other, and that may be what ended up happening. That may be why that happened. It's tough to say. I'm not sure if that's what the reason why is, but the really way scars work is not really that it's because someone picked, although sometimes that is part of it. But what it could be is actually that really just had bad luck. Your genetics were such that when you had acne, your body produced a really severe immune response. It destroyed some of your bacteria in the acne, and then it also ended up destroying some of your skin, also some of your fat even. That's how bad of a reaction occurred. So it's like this really hyper reaction that occurs whenever there's a bit of a cystic lesion over there. Would you say turmeric soap would help? I mean, it's okay, but I'm not a big fan of like harsher soaps in general. I think that people go too harsh with soaps, and soaps for like actual treatment purposes, it's tough to say really it's going to help much other than maybe a little bit of pigmentation for something like turmeric. But there's probably better options out there. If you want just like a soap, you could consider like a sulfur wash. That could help. Sulfur washes work well. So maybe consider that. Vincent saying, I had RF microneedling done for my acne scars, planning to add exosomes. Is it worth it? Or should I choose a scar healer? I don't love RF microneedling for scars. So that's like it's a bit of a trick question. So I don't love it for scars. Katrina is saying, my acne scars are from when I was 15. I'm now 30. Is it too late for effective treatments? No way. No. It's definitely not too late. We absolutely could treat you at all age groups. So do not worry about like how old you are or if there's a collagen response. Ultimately, we still could get that collagen response. We ultimately can still get it. It may take a little bit longer for some patients if it's a little bit thicker scars, but I'll break up that scar tissue really well. For those that's asking, you could, how do you book an appointment? You could go on my page, Dr. Qazi. Our prices are on there, and then the consultation fee does go towards your treatment, though. Let's see here. How do I treat a scar with a communicating tract? That's a good question. I'll have to show something at some point. But basically what you're talking about is basically this bridge that could sometimes occur where let's say there's a wide scar and then there's a bridge on top of it. A lot of times just destroy that bridge actually. Just destroy the bridge and then we try to flatten out the area surrounding it. So it depends on how thick it is, though. It depends on how thick it is. Sometimes the other option is to basically get it so that you could get the other portion of it lifted up a bit there. But unlikely, if it's truly a true bridge, those are usually pretty thick. I just want to typically destroy that and get closer to the base of the scar with my laser or like the peel or anything else that we're trying to do to resurface that. I'm going to wrap it up right now, but someone's asking from an evolutionary perspective, why would a trait like acne persist in populations? Is there an advantage? I would not say necessarily there's an advantage. There's probably like oily skin by itself probably is helpful for a certain population for in probably dry climates, but acne by itself, I don't think that's going to particularly help much with anything. But oily skin probably did help for people who were in more of a drier climate, though, because otherwise their skin would have just gotten torn apart, though, with how dry it would have been, let's say, like a desert climate or so. So that's probably if I had to guess, but it's tough for me to say. Sana is saying that they asked my question 20 times. I'll try again next time. Sana, you could ask it one more time. I'll wait before I leave for your question here. You've apparently asked it 20 times. Sorry, there's a lot of questions today. Well, no, I'm sorry. I'm actually thinking. It looks like I'm out of my jail for a little bit. How old am I? I am almost 43 now. Almost close to it now. I was just talking to one of my patients who's on here right now. We're talking about La Femme Nikita back in the 90s. He knows what I was talking about. I don't know if anybody else knows about that. La Femme Nikita, talking about some good music. So just so you know, there's actually some good. He was talking about he's learning French and understanding French music. And so if you ever want to take a look at that, that's how old I am. I know about La Femme Nikita TV show from USA Network. What's the healing process for TCA? It's just like 1 or 2 days. 1 or 2 days of that. It's not too bad actually. All right, guys, appreciate you. Oh, wait, where did Sana go? I was waiting for you. Sana, I'm waiting for your question. Law of Trends is saying, hi, paid for a consult, but your office hasn't reached out to book. Can you message me, like just DM me right now? Because we try to message everybody, but we'll see if somebody got missed there. I'll double check, but please message me so we can know exactly what happened there. And let me know also what day you did that. What day did you do the consultation? What time did you try to schedule it? Do you think that Retin-A can eliminate this type of scar? It'll help mildly, not much. So this patient was on it. It didn't really help much for her though. If you have 5 ice pick scars, will it be cheaper? It depends. I mean, yeah, it's probably not be much involved then. Yes, it could potentially be cheaper. And guys, I will be on here again tomorrow. I'll see everybody on